Qsymia is used with a doctor-approved exercise, behavior change, and reduced-calorie diet program to help you lose weight. It is used in adults and children 12 years or older who are obese. It is also used in certain overweight people, such as those who have weight-related medical problems. Losing weight and keeping it off can lessen the many health risks that come with obesity, including heart disease, diabetes, high blood pressure, and a shorter life. The medication is a combination of Phentermine and Topiramate. Phentermine is an appetite suppressant and belongs to a class of drugs called sympathomimetic amines. Topiramate is known as an anticonvulsant or antiepileptic drug. It is not known how this medication helps people to lose weight. It may work by decreasing your appetite, by increasing the amount of energy used by your body, or by affecting certain parts of the brain. It is important to take Qsymia as directed by your doctor. The usual dose is once a day in the morning. Your doctor may adjust your dose to find the best dose for you. Remember to take it at the same time each day. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Do not double the dose to catch up. Before you start taking Qsymia, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning to reduce the risk of insomnia. Swallow the capsules whole and do not crush or chew them. The dosage is based on your medical condition and response to treatment. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to drink plenty of liquids while taking this medication to prevent kidney stones from forming, unless your doctor instructs you otherwise. If you suddenly stop using Qsymia, you may experience withdrawal symptoms such as seizures. To prevent withdrawal, your doctor may lower your dose slowly. It's important to take this medication exactly as prescribed to lower the risk of addiction, as it may sometimes cause addiction, especially if you have a substance use disorder. Women who are pregnant or may become pregnant should not handle this medication, as it can be absorbed through the skin and lungs and may harm an unborn baby. If you find that Qsymia is not working well after several weeks of use, talk to your doctor. Your doctor may direct you to stop taking this medication. Some common side effects of Qsymia include dizziness, drowsiness, dry mouth, difficulty sleeping, tiredness, tingling of the hands/feet, joint pain, constipation, and metallic taste. If any of these effects persist or worsen, contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people taking this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as difficulty concentrating, signs of kidney stones, rapid breathing, irregular heartbeat, bone pain, loss of consciousness, changes in sexual ability/interest, unusual bleeding/bruising, or any unusual/sudden changes in your mood, thoughts, or behavior. Rarely, Topiramate, one of the components of Qsymia, may cause a serious eye problem. Seek medical help right away if you experience sudden vision changes or eye pain/redness. Qsymia may also rarely cause serious lung or heart problems. Stop taking the medication and seek medical help if you experience chest pain, difficulty breathing, fainting, or swelling of the legs/ankles/feet. In case of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you experience any other effects not listed here, contact your doctor or pharmacist. And remember, it's always best to consult your doctor or pharmacist for personalized advice. In the United States, Qsymia can only be obtained through the Qsymia REMS program. This program has specific requirements that you must understand, agree to, and carefully follow. If you live in Canada or any other country, consult your doctor and pharmacist for your country's regulations. Before taking Qsymia, it's important to talk to your doctor or pharmacist if you have any allergies or medical history of certain conditions, as this medication may contain inactive ingredients that can cause allergic reactions. Qsymia may cause dizziness, drowsiness, or blurred vision, and it's important to avoid activities that require alertness or clear vision until you know how the medication affects you. This drug may also make you sweat less, increasing the risk of heat stroke, so it's important to avoid overheating and stay hydrated in hot weather. If you have diabetes, you may need to check your blood sugar more regularly and adjust your diabetes medication. Before having surgery, be sure to inform your doctor about all the medications you are taking. Qsymia should not be used during pregnancy, and reliable forms of birth control should be discussed with your doctor. It is also important to note that this medication can be absorbed through the skin and lungs and may harm an unborn baby, so pregnant women should not handle this medication. Additionally, Qsymia can pass into breast milk and may have undesirable effects on a nursing infant, so it is not recommended to breastfeed while using this medication. It's important to be aware of potential drug interactions that can affect how Qsymia works or increase the risk of serious side effects. Make sure to keep a list of all medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors with Qsymia, as it can cause a serious and possibly fatal drug interaction. Also, be cautious if you have taken other appetite suppressant drugs in the past year, as serious interactions could occur. Be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness, as well as any products that could raise your heart rate or blood pressure. If you are taking hormonal birth control with Qsymia, inform your doctor if you experience any new spotting or breakthrough bleeding. Additionally, be mindful of consuming large amounts of caffeine, as it can increase the side effects of this medication. Lastly, be aware that Qsymia may interfere with certain medical and lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this medication. If someone has overdosed on Qsymia and has serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. Symptoms of overdose may include rapid breathing, unusual restlessness, fast/slow/irregular heartbeat, chest pain, hallucinations, seizures, loss of consciousness, and severe drowsiness. It's crucial to call 911 or a poison control center right away for assistance. It is important not to share Qsymia with others as it is against the law. Before starting and during the course of taking Qsymia, you may need to undergo various lab and medical tests including blood pressure, heart rate, heart tests, eye exams, kidney function, blood sugar, potassium, and bicarbonate blood levels. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, just wait until it's time for your next one. Don't take extra to make up for the missed dose. When it comes to storing Qsymia, it's important to keep it at room temperature, away from light and moisture. Make sure to store it in a secure place, away from the reach of children and pets. When it comes to getting rid of any unused Qsymia, it's important to properly dispose of it according to the instructions. This can usually be done through your pharmacist or local waste disposal company. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. And always make sure to discard any expired or no longer needed product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.